We've all had those family and friends who are particularly clumsy. We've all seen those reality shows with people doing incredibly stupid things, as seen on MTV. And we all know how accident-prone kids can be. So it's not completely out of the question for any given one of us to run into an eye injury, particularly an impaling eye injury. My medical surgical nursing book states that 2.5 million eye injuries occur each year. 1 in 10 of those eye injuries will lose useful vision in that injured eye. So in my speech, I will show you how to safely secure an impaling eye injury, how to prevent any further injuries, and how to hopefully cut down on any infections. So listening to this speech should give you the skills to help a family member or a stranger for that matter hopefully preserve their vision after an eye injury. The first thing to remember is safety first. You need to keep calm and keep the victim calm. When you come across a victim, the first thing you need to do is scan the area and make sure there's no impending danger. You don't know what caused this injury. You don't know if there's someone still around that could injure you or if there's anything falling that could injure you. At this point, you may need to call 911 depending on what the situation is or how bad the injury is. Always wait for the scene to be safe. The person may be very close to you and you feel like you could just get to them and help them, but if you're putting yourself in danger, that's not going to help anyone. Next, you need to see if there are any other injuries. There may be more important injuries to assess and address before we take care of the eye. Also, never ever remove the object from the eye. This could cause major bleeding, and that object that's in the eye could potentially be laying on a blood vessel and keep the eye from bleeding. Next, we want to treat the injury. A lot of times we have first aid kits in cars these days, so hopefully you have one of those close. If not, you have to use whatever is close to you and become MacGyver to a point. You need to stabilize and cover the wound. So typically we'll all have some sort of cup in our car. Hopefully you have gauze and tape in a first aid kit. If not, you can use a clean cloth. Like I said, cleanliness is the key, but you have to use whatever you have available. So you would take the cup and cover the eye. One website said possibly cover both eyes to cut down on movement, and just tape it around the eye to keep it from around the object to keep it from moving. You could take a cloth, tape it around, keep it from moving. In conclusion, you should have learned steps to help stabilize an eye injury and keep further injury from happening, further infection from happening. Most importantly, keep yourself safe. Stay calm and assess the situation. If it is safe, make sure that the victim doesn't have any other more serious injuries. Keep the patient calm so no further injury is sustained, and besides safety, it is always important to not remove the object from the eye. Since most accidents don't happen in the most ideal situations, you may just have to use whatever you have and the cleanest supplies available to cover the eye and keep the object secure from movement until you can get them to the ER or emergency medical staff arrives.